Hello, everybody, and welcome back. This is The Edge of Adventure. Great to have you with us. Of course, my name is Adam Asher, and my very special guest today is Alka Subramanian. And she's joining us from the Power of Love Foundation. They're doing great work in two countries in particular, in Zambia and in India. First of all, Alka, welcome to the program.
Thank you, Adam. Thanks for inviting me. I have actually listened to a few of your podcasts, and I truly enjoyed each and every one of them.
Well, thank you. Thank you so much. Well, it's an honor to know that you listen, and it is an honor to get to know you today and to be able to share a little bit about this wonderful vision and the work that you guys do. As I've researched your organization, Power of Love Foundation, I know there are many different areas in which you work. There are a lot of things here, a lot of wonderful things, and we're going to dig into them a little bit at a time. I've even taken some notes here to make sure that I get to all of them. But
Oh,
let's talk big picture though, to help the audience know the heart and soul of Power of Love Foundation is what?
Uh, that's a good question. The heart and soul of our foundation is the provision of healthcare and women's empowerment in Zambia and India. We are a small organization, and we do things a little bit differently. And because we see ourselves really as an innovation lab. And what I mean by that is that we build models and try to find new ways of solving problems, and then we test and implement those solutions. Uh, for example, we have built a model of care that provides healthcare services to a large number of children with a relatively small budget. And we've been running that model for the past 20 years.
Alka, you said that you guys are a small organization. Okay, convince me, because when I look at all the different things that you're doing, I think it's amazing, truly. So you're very effective, very efficient. You might think of yourself as a small organization, but there are so many wonderful things that you guys are doing. And as I've mentioned, I got to do my job here, and that is kind of go through the different parts of it, and we'll see by the end of the program. We'll see if I've done a good job. But first of all, the thing that I want to help to understand is this focus on healthcare. Okay, and that's one of the focuses that you guys have. What are the needs right now? If you look at Zambia, you look at India. What are the needs in each of these locations? Are they the same, and or how do they differ?
There is a huge need for a pediatric HIV care program and a women's empowerment program in both countries. And our pediatric HIV care program, which is really the cornerstone and the focus of all our work, and everything else evolved from there to what we have right now. It provides food, medicines, education, adherence support, school support. Really, our goal with this program is for no child to ever develop AIDS so that the current generation is AIDS free. And believe me, it is possible. We also have an elimination of vertical transmission program with the idea that no child is born with HIV so that the next generation is HIV free. And the needs in both countries are similar, though we have different models in the two countries that we work with because the way they are structured.
One of the things I think that makes your organization unique is the degree to which you involve the families. So, as you seek to improve the healthcare for the children, and you've talked about some of the ways in particular that you guys seek to do
Mhm.
that, your emphasis and your involvement of the entire family is important. Explain to me why.
Uh, so, at the time that we started this work, the year was 2000. AIDS, the epidemic of HIV and AIDS was at its peak. And the AIDS medication or the antiretroviral medications were too expensive for most people in sub-Saharan Africa to be able to afford them. It was a little bit similar here too. They were really expensive. Children who were born with HIV had a life expectancy of just 4 to 5 years, and pediatric HIV doses were not available. Pediatric doses were not available. Uh, and we had young children at the time, and we strongly believe that healthcare should be available to all children, irrespective of where they live. So we also knew that the number of children who are living with HIV is so large that you really and children were being orphaned. There are about 1 million orphans living in Zambia at this time. So you cannot really build enough institutions to house them. If the family can provide care, and if you can support the family in caring for the child, that would be a better solution than building institutions or orphanages. It was just not possible. So we really involve the family, we train the family and educate the family in HIV before we enroll the child, and we kind of push the caring of the child to the family so that the whole family is involved and we support the family, and that has worked really well for us and with the African culture.
Alka, what type of care do these precious babies and children born with HIV, what type of care do they require?
Well, in addition to just the loving and a supportive environment at home, they require medicines, of course, but medicines, just provision of medicines is not enough, because, medicines need to be supported with food and school support and education and training in adherence. So these children and their families really require training in how to care for an HIV positive child, education in HIV, regular monitoring of the child. So that's why we built a model that allows us for us to visit the children in their homes, take their vitals, have a discussion on the health of the child with the caregiver, with the primary caregiver on a weekly or a bi-weekly basis. And once the child is old enough, make them understand the importance of adherence to medication. Actually, it starts with the family caregiver. The family has to understand that the medication has to be taken regularly. And when we are looking for adherence, we are not looking for 70%, 80%. We are literally looking for close to 100% adherence. Otherwise, the health of the child can be compromised in a huge manner. So the family has to understand the need for this compliance with the medication regimen. And as the child grows older, they also need to be educated. And once they understand it, it becomes easier.
Alka, for those of us who are not as familiar with the current crisis in Zambia, put it into, and even in India, perhaps, put this into perspective. How big of a problem is this? Children being born with HIV.
So, like I said before, without intervention, the life expectancy of a child who's born HIV positive is just 4 to 5 years. But with intervention, with the proper education and training and food and medicines, the child can live a normal life as it is in other developed parts of the world. HIV is not a death sentence in the developed parts of the world anymore. And we want the same to be true for children growing up in sub-Saharan Africa and India.
So there's so many different things to talk about. I think I've established that. I've got one more question in particular that it relates directly to HIV. You said one of the things that you work toward is the prevention of what is called vertical transmission. So an HIV positive mother preventing the child from also being HIV positive. How does one do that?
That's a great question. Once we know that the lady who's HIV positive in our program and she's expecting a child, we immediately put her on what we call the elimination of vertical transmission protocol, which means that she has to adhere to our ARV medication, take the drugs as specified by the doctor, and at the time that as she gets closer to pregnancy, she will be given and during birth she will be given a drug that cuts the transmission of the HIV from mother to child. So it's just that the mom has to be aware of her HIV status and continuously take the medications that are required for the child to be born HIV free. And we've had huge success in our program. None of the children in the last 7-8 years who have been born to HIV positive moms in our program are HIV positive. And this is possible for the next generation to be HIV free. I strongly believe that.
Alka, you did mention that this Heart for Healthcare and these types of things was a key part of the founding and sort of a key principle and a key area of focus for Power of Love Foundation. But that you then found other needs, you encountered other needs, and you found other ways to help to improve the communities and ultimately the culture. As you look at the program that you all have, you mentioned women's empowerment. I'm sure there's a variety of different ways that you address this, but one that I would want to bring the attention of the audience to is the micro loans,
Mhm.
helping them to what? Start businesses?
Yes. So, we discovered pretty soon after starting Power of Love that poor health is not an isolated phenomena. It is linked to poverty, it is linked to social and cultural norms. Most of the families of our children, they did not have a regular source of income, and the women had very few marketable skills. So just provision of food to one child in the family is simply not going to cut it, or going to be a sustainable situation, will not go towards making the family sustainable. So we started the microloans program uh, with the idea of training women in business, providing them with support and providing them with loans so that they can start businesses. And earnings from these businesses help pay for necessities such as food, medicines, rent, and most importantly, school expenses.
Alka, another very interesting um, aspect. Again, I think of it from the perspective of those who are in the West and maybe we don't deal with these challenges here for whatever reason. Malaria, for example, is malaria a factor in the areas where you work? And if it is, how do you combat it?
So malaria is a huge problem in sub-Saharan Africa and in Zambia in particular. We lose a child every 2 minutes to malaria, which is unacceptable because malaria is both preventable and curable. And even if a child recovers from malaria, they have an impact on their immune system because their immune systems are still not developed throughout their life. So if a child goes through malaria once or twice in their lifetime when they're young, even if they survive malaria, their health has been compromised for the next several years. And like I said, since it's both preventable and curable, there is no reason for malaria to be even in existence. And we strongly believe, and the UN AIDS also believes, that Zambia can be malaria free in the next 3 or 4 years. So, to that extent, we have a malaria prevention program. We just completed the provision of 50,000 nets over the last few years. And this year, we provided 15,000 nets to families so that people can be malaria free. One of the outcomes of this program is that none of our children contracted malaria and none of our families contracted malaria.
Alka, of course, Power of Love Foundation, as you work in Zambia and in India, as we have established, you are so focused on the healthcare and the health of the children and the families and ultimately the communities. See, you can't really have a conversation about healthcare in the modern day and age without bringing up the current pandemic and talking about COVID. How has that fight changed or altered what you all do?
That's a great question too, and in some ways, COVID made us stronger. I can say that now, having devised ways to combat the pandemic. Last year, in April 2020, when the pandemic hit, it was truly concerning. It was really scary for us here at the Power of Love team because our children are all HIV positive, they're immune compromised, the families are immune compromised for one reason or the other, and even the women's businesses with the COVID restrictions, they could all have gone under. So it was a truly scary situation. However, we came out stronger because what we did is we made a number of programmatic changes. We switched from a home visit in-person model to to a telehealth model. We made sure that all families had phones. We created a calling tree, and we are now and we trained our staff. So we are now actually we have ended up monitoring our children and our women's businesses more closely than before. Some of the changes we made were, for instance, we ensured that families collected their medicines for a 6 month time period as opposed to a 1 to 3 month period, so that they can reduce clinic visits. We made sure that children all had their viral load results from the government clinics. And we added COVID education workshops and provided PPE to all our staff and families. So this is how we came out stronger after the pandemic, and all our children are doing well, and none of them contracted COVID.
This is The Edge of Adventure. That's the voice of Alka Subramanian, and she is the founder and the executive director at Power of Love. So we're talking about their work today. They work in India, and they also work in Zambia. You mentioned education, right? When it comes to these different challenges, it's important to educate the individual, educate the families and the communities. I know that this is another area, education in general, education
Mhm.
of these precious kids, that's something that's important to you. Talk to me about that. Also, the Young Stars program. Those are the two things I see working hand in hand. How are you helping with the education in these communities, and then also how are you helping to mentor these kids and show them the way to a better future?
Well, yeah. So, if I was to sum up all the focus of all the work and the programs that we have, is it's really can be summarized in just two things. We want our children and families to be healthy, and we want our children to be in school or educated. To that extent, once the food and the medicines and the health monitoring and the adherence training and education is taken care of, we wanted to make sure that our children are able to, the families are able to pay for school expenses and the children stay in school. So at this time, 95% of the children who are eligible for school are in school. We provide them with school support, which is fees, funds for school bags, shoes, and uniforms. Now, the good news is that from January of 2022, there is going to be no school fees required. The Zambian government has taken school fees off the table, even for secondary and higher schools. Elementary schools were always free. So that means that it will be a huge uh, benefit to the families, and all of the children can attend school. Also, once we found that there were a few children who were really keen on school, they were extremely bright, they were doing well, but as they entered secondary school and higher grades, their families were not able to pay for their fees. Plus, their families were having, difficulty in just putting even food and paying for rent. So we selected a few children for our Young Stars program. And in addition to the food and medicines, and we also provide them with rental support and some expenses, we mentor these children on a one-to-one basis. It's like a big sister, big brother program. So a couple of our healthcare team members visit these children. I mean, now it's mostly over phone over the last 18 months, but visit them twice a month, ask them how they are doing at school, meet with the school teachers, get their school progress and academic reports, make sure that they are prepared for their exams, and that during COVID that they were not lagging behind. So that the children are doing well. They're graduating high school. We have a number of high school graduates in our program now. And another way we uh, work with the children is we invite our children who are now 18 or older, who have been on the program, to come back and mentor the young children. So that's how our school support and school education program works.
Alka, what would you say makes Power of Love Foundation unique?
I would say one is that our staff, uh, 90% of our staff lives and works in the areas that we work in, both in Zambia and India. Most of our staff lives and works there. So they are embedded in the communities. They know the challenges faced by our families, and they can understand them at a personal level. And the families have no hesitation in sharing information about the health of the child and some sensitive topics, because as the child grows older, we do have to touch on STIs and sex education and safe sex practices. So the same community health worker being with the child for the last 4, 5, 6, 7 years enables the child and allows the child to be frank and express or have or discuss questions on sensitive topics with our team. That's one. Two is we don't compete. In some organizations I know actually compete with the local organizations. So we work with churches, we work with the government health clinics, we work with the local organizations. The churches and the clinics provide us with referrals for children who need the care. The clinics provide us with the ARV medication for the children, and they provide us with the access to a doctor and a hospital because we do not have a doctor on our payroll. Like I said, we are able to provide the healthcare services and school support and the Young Stars program to many children on a small budget because we work with all these organizations and partners. Uh, and in return, we refer our children to organizations that can provide skills training, vocational training, or some support as the children get older to these organizations.
Alka Subramanian is our guest today from Power of Love Foundation. She's the founder and executive director. You founded this organization, if my information is correct, in 2003, right?
Yes.
So we're looking at almost 20 years.
Yes, we are looking at 20 years.
So I'm going to ask you a very easy question. What have you learned in the last 20 years?
Oh, that's we actually, and you'll say define small, but we feel that even a small NGO can make a big impact. Um, we know that working with local partners is critical for the success of a grassroots organization. As I mentioned before, we work with churches, with government clinics, with schools, because the schools provide us with the academic progress of the child, and they allow us to meet with the teachers if the parents are unable to. Uh, we learned also that in order to have a long-term impact, it's really important to work closely with the government. And some NGOs feel that government organizations are slow to change. They do not accept new ways. But we think that's a myth. If we can work with the government, we can effect long-term change. Another way we feel we are different is that one, we feel that health is not an isolated issue. It's a combination of poverty, lack of opportunity, uh, lack of education, which all comes together, leads to poor health, and the whole cycle goes on. So medicines need to be supplemented with food, with education, with training, and with skills generation or women's empowerment programs. But finally, I think data collection or data gathering is very important to us. So we try and gather data so that we can use the information to improve our work.
Alka, there's a couple of other programs. Again, I just have to go back and point out how thorough this organization is, all of your efforts. I can see it as I've done my research, as I see the different programs that you have and that you've worked on and through. You approach this problem, as you just said, and all this stuff is interrelated, right? And so
Yes.
one of these projects affects the greater project as a part of the overall objective. So tell me about goats and tell me about trash.
Okay. Well, the trash program was a really, fun project. We connected with a professor of chemistry in Nebraska, and he had technology that made it possible for trash to be converted into window screens to prevent mosquitoes from entering the home and mosquito nets. So a couple of we had a few workshops on the ground where we trained women in how to gather the trash, clean it, and make it into window screens so that prevent the entry of mosquitoes during malaria season. We also trained the women in using this trash to make very attractive handbags, school bags, covering. And some of the material that we use was literally, we buy thousands of nets every year for our malaria prevention program. And the packaging that those nets come in, I think you showed a couple of pictures earlier, and the white packaging those nets come in, those can be used in various ways to make school bags, to make, covers for some of the shops that our women started. And this is a great picture of, a marketplace where our women have their businesses. So the Trash to Treasure project was a great uh, project. So we trained the community in how to convert trash, which of course had several benefits in terms of cleaning up the neighborhood. It was environmentally friendly, and it generated an income for some women. And of course, it saved them money because then they could make school bags or handbags.
That's the trash. Now tell me about the goats.
Oh, so we had actually one of the communities gave us a spot of land, uh, and to rear goats. And the idea with the goat farm was that with investment of a few resources, we could rear the goats. And we trained our team. They were taking care of it to rear the goats, and so that then they can be sold. And some of the earnings from the goats project could then be recycled back onto the uh, programs, so that the programs become more self-sustaining.
Alka, thanks so much for taking the time today as we get to know Power of Love Foundation, your work in India and also in Zambia. I know the family and the community in both cases are very important, and they are similar, but the roles they play are different. Let's take them one at a time. Let's first talk about the family. Uh, what does it mean to you and to Power of Love Foundation when you talk about having a family or helping to ensure that the families are sustainable?
Okay, yeah, so that's a great question. And as I mentioned before, we would like, our goal really is family sustainability. So even in our women's empowerment or microloans program, our goal is family sustainability rather than maximizing repayment rates. And by family sustainability, I mean that we look at the family as a unit as opposed to just, focusing on the child or the woman to provide loans with. So we target the different family members with different programs. So you have the, pediatric HIV care for the child. We have education and training for the family members. We have the women's empowerment program for the woman of the house. And we also have the mentoring program for children. But in addition to that, we realized that these families were using charcoal as a fuel, and the charcoal stoves that they were using were generating a lot of smoke, which was impacting their health adversely. So we got a grant last year from a company in India, which got a grant from a Korean company, and we were able to provide clean cooking stoves to 8,100 families over the last few months. Now, when we got the grant, it was at the beginning of COVID, and it was like, oh my gosh, this is probably not the right time to get the grant. How am I even going to distribute these 8,000 stoves to families with COVID restrictions? But again, with the small gathering, social distance, and training and education, we were able. It took us longer than we anticipated. We could have provided those 8,000 stoves over 6 months, but it has taken us almost 14 to 18 months to provide the stoves. But what the stoves did for the families was there was reduced smoke inhalation, which improved their health. They saved money on fuel because what the stoves required was just wood and paper, which was much cheaper and easily available as trash in the neighborhood as compared to charcoal. Cooking was easier, cooking times were reduced, friendly to Zambian cuisine, and zero carbon footprint and friendly to the environment. So our families are really enjoying these stoves. So that's what I meant by family sustainability. Complete healthcare with malaria bed nets, with the women's empowerment, children mentoring, clean cooking stoves, and encouraging our children to come back and continue to adhere to their medications even after they have left the program. What I'm trying to do now is also, as children who have left the program and are in between going to college, if they can come back and if they want to start businesses, that's what we are encouraging the children to do right now.
Alka, what role does the community play? If you think of the community as a whole,
Mhm.
in the areas where you work, what role do they play in identifying the problems?
So In Africa, there are the two big institutions that are really important is the church and the family. So the church members and the church pastors know which family requires more help. They are aware of the challenges that are being faced by a family or if a child is sick. So it's the church pastor who actually calls and says, okay, Christopher, our nurse, he calls Christopher, our nurse, or one of our healthcare team and says, this child looks a little unwell, is not responding to medication, has had fever for so long. So can you, take a look? And we take a look, we test the child, we provide support to the family. So communities are very much engaged. We are also engaged with the community because we constantly ask for their feedback on how to improve the program. For example, when we created the calling tree, when we switched from the home visits and face-to-face health monitoring to a telehealth type of model, we had to gather contact phone numbers for everybody, and we needed the help of the community to give us and help us create the calling tree in case somebody was not available on the phone right away. So these are the ways that the community is involved. More importantly, our families share their learnings with others. So the whole community becomes stronger. So you see a mom, her child was unwell last week, and within 1 month, the child is doing well, back in school, goes in a school uniform. That prompts the other families to ask questions. And this mom proudly says, look, I've started a business. The business training really helped me. I'm more confident. I'm not lacking in anything. Adam, these are women who, when they say they are not lacking in anything, what they mean really is that they have the food and medicines and money to pay for rent and children are in school. No more than that. I've had women tell me, I am so happy because I can buy pots and pans. So these are pots and pans that they use every day for cooking, and for some of them use them to, make fried chicken or fritters for their business. So just simple needs are met and the women are so happy. Their lives are transformed and they're truly grateful.
Alka Subramanian is my guest today from Power of Love Foundation. She's the founder and executive director. Look them up online at poweroflove.org. Alka, what keeps you going?
It's just, when I go to Zambia, some of the women, as I'm chatting with, they'll say, Alka, look, I've put on cheek, So putting on cheek means putting on a little weight on your face. Things are changing, but it's still a good thing. It means that they are eating well. They are going from, not knowing where the next meal is coming from to two to three meals a day. Medicines they can pay for rent. Many of them move up to independent accommodation as, opposed to being dependent on relatives. Many of them build homes. Many of them have purchased plots. It's so encouraging and inspiring to see, them buying, okay, I'm going to buy 10 cement blocks today. And with the next loan, my plan is to save, to put the children in school and buy another 50 cement blocks. I do want to share one story of a lady which doesn't go away from my mind. So this lady who's not been to school, she was struggling to put food on the table for her family and for her children. When she received business training, and she was on the younger side, I would say just between 34, 35 years old. When she received business training and she was trying to find a business idea, she was chatting with her husband who had a part-time job in a car garage, which repairs cars. And he said that at the right price, the car garage owner may be willing to buy parts from her. So this lady who's never been to school trekked all the way to South Africa by bus, crossed the border, and came back with these heavy rods which went into the car parts and some adhesives which she was, the supplier was ready to buy them at the right price. So she discovered a supplier at the right prices, and her family is doing well. Her children are in school. There are hundreds of stories of these women and children who are now graduating high school. And at the time of enrollment, we didn't know if the child would make it. They're going to university. They want to be lab technicians. They want to be nurses, teachers, just like our children everywhere.
Alka, you clearly love the people of Zambia and the people of India, and I suspect people everywhere. If we were to get right down to it, this is kind of a part of who you are. This foundation is named Power of Love Foundation. Explain to me the power that love has.
Okay, now that takes me back, and I could probably tell you a funny story also. You may or may not want to include it, but two things. One is that it's it's literally the power of love which sustains a child. It's not the food and the medications, but it's the love and the caring that is really important. So we strongly believe that if the child could stay with the family, with the extended family, that would be a better solution rather than pull the. In fact, in the beginning we were thinking of starting uh, a home care or a residential care facility for children, but then we moved to the home care model, which worked better in the cultural context of Zambia and Africa, and the children are loved and cared for in a home environment, and that's truly important for us. As we were discussing the names, many people said that you don't want to use the name Power of Love because some inappropriate sites are going to come up. But then we stuck with the name for our principles.
Well, we live in a world now where that's probably the case. No, if you do a search and you put in the wrong names,
That's
you're likely
correct.
to get who knows what. But there is something very powerful about love, and this love that you have and your team has for the people that you work with, for the communities, for the families, for the kids. They're in Zambia and also in India. If you were to give me a rough estimate, how large is this team that you have? If you factor into it people that are involved, including volunteers and all the different uh, people helping you get this stuff done.
So in Zambia, we have a staff of 10 people, and they're truly dedicated to all our programs. And I do want to give a shout out to my teams in Zambia and India. They're dedicated, they love children, and we couldn't do a thing without them. In the US, we are a 100% volunteer based organization. So we have no employees. We have 3 or 4 volunteers who volunteer with us for several years, or they go and come back. Our board is completely volunteer based. We have an RN on the board. She goes through all the call logs of the children, the medical records of the children, and make sure that, and that's in some ways, that's how our digital doctor program works. Um, so we have a very small team in the US, really. It's the board and a few, 3 or 4 volunteers. 100% of funds raised from private donors go towards programs in Zambia and India. And we keep our overheads very low because we work out of our home offices.
Alka, I have two questions left, and then we'll wrap the interview. There's so much more, so much more. This is a very inspiring organization. You're doing great work both in India and in Zambia. So let's draw the interview, though, to a close with the following two questions, okay?
Mhm.
What is next for Power of Love Foundation?
That's
Especially,
actually that's something that we are actually working with right now. What we have found is that in addition to poor health, and actually poor health is related to what we want to do next, is we want to also work in the areas of mental health and maternal health in resource poor communities and in the slum areas, because mental health is a huge issue, and COVID has only brought that to the forefront. And especially with our requirements with the HIV environment and the stigma associated with it, mental health is huge, and we want to add some programs that focus on mental health. Another thing that we are thinking of, we've actually incorporated some of it already, is climate change has impacted the poorer communities disproportionately. For example, and I was listening to the podcast, your Seed podcast in Madagascar, and even the Malawi podcast with the Abundance Project. Climate change impacts, slums and resource poor communities disproportionately. So we want to incorporate some of the climate change activities going forward. Some of it has already been incorporated because we are expanding the Malaria Nets program, because with climate change there may be more flooding, and that leads to waterborne diseases and the growth of mosquito larvae. So we are ramping up our nets provision program in order to accommodate it and keep Zambia and India malaria free.
Alka Subramanian is my guest today, Power of Love Foundation founder and executive director. And it's been about 20 years, 19 years or so that she's been working in this capacity. And so I appreciate your time today, Alka, and your heart and your just the soul that you pour into this for all the people that you're involved with leading, the great people you get the chance to work with, and of course, the families, the communities, and the children whose lives are impacted. So let me wrap the show with a question that should be very easy to answer, as these philosophical ones are always the tough ones, actually. Alka, why are you called to this work, and why do you do it?
In some ways, of course, at the time that we started the organization, I have three children, all of them were young. And I strongly believe that if you want to keep all children healthy, and if there are two groups of children, if you want to keep them safe and healthy, both groups have to be safe and healthy rather than just the one group who's living in a certain part of the world. And once we read more about the HIV and AIDS issues, the women's empowerment, and the lack of education, that lack of opportunities for girls and young boys, I, I I'm really doing it for myself. It gives me so much just joy, and uh, I would just say I'm doing it for myself. And two, I don't know that I can do anything else anymore. I'm incapable of doing anything but working with our teams, both in Zambia and India, and the children. I literally can't. I mean, I was a professor for several years in my past life. So, but I don't know that I can go back
You
to that.
can't go back. Yeah, that's an interesting topic. I think that we'll have to have you back on the show sometime to talk about that in particular, because there is something to be said for that. I think when you're doing something that you love and something that you know has a positive impact, and you get that satisfaction of knowing, hey, my efforts, as humble and as meager as they may be, I know
Mhm.
that they're making a difference, at least in the life of one person, and then another person, whatever small. It's not that,
Yes.
nobody's a hero and we're not changing the world here, we're just doing what we can. But when you feel that, it's a very powerful feeling. And I can't imagine you going back to being a professor either, Alka. I think you are doing what you should be doing, and you're making a difference. So, what a wonderful, wonderful opportunity we've had today to get to know you a little bit. I mean, there's much more to cover, I'm sure, but also to get to know Power of Love Foundation. And my request to the audience today, whether you're listening to the audio version or the video, watching the video version, my request is, if this has struck a chord of some kind in some way, if you think to yourself, this is something I should be involved in, I'd like to come alongside Alka and her team and help in some way. My encouragement is, do it. Reach out to them. Let them know that you heard the program here and that you'd like to find out a little bit more. Encourage them in any way you can. And of course, I'm sure financial donations and support is always needed to make these sorts of things go round. Of course, it takes the finances and the donations and the gifts of people around the world who care about these communities in Zambia and India. So, to find out more information and to give online, all that good stuff, you can go to poweroflove.org. That's poweroflove.org. A great organization doing great things in Africa and also in India. Alka, thanks for joining us. Anything
Thank
else?
Thank you, Adam, for finding us on the web. Thank you for doing this and introducing so many organizations to people who care.
Well, it's my privilege. It really is. And I just am thankful for you and for your leadership and now your friendship. So thank you. We'll be in
Thank
touch. We'll have you back on in the future to give us an update. In the meantime, thanks for standing for those kids and those families and those communities.
Absolutely. Thanks for your support too. Thank you.
Thank you, Alka. And thank you all for joining us for another edition of the Edge of Adventure podcast. We'll see you again next time.